Okay, so it is January 26th at 2:15 p.m. and this is the All Together Partners meeting, and we are going to start the recording now. So now we'll jump into some staff updates. Hillary, if you want to go first with anything that you'd like to share with the group, please.
Sure. So I believe at our meeting in November, I had touched on this. So one of the things that Andrea and I have been working on this past year, both as something that we wanted to do in conjunction with our community survey, but also use it as an opportunity for us to get to know some more community partners, since she and I are both relatively new to our roles, was to have stakeholder interviews. So we, over the course of the fall and into December, had interviewed, I think we've now completed 10 stakeholder interviews with a number of different community members, including 3 law enforcement agencies, which we were really excited about, to just understand what are people seeing in the community as it relates to youth substance use and youth mental health. And so right now that we've completed those interviews, I'm in the process of compiling all of that information into a report, and we'll hopefully have that report ready to share soon that we can share out to the coalition, and also put on our website as well. Just using it as a way for us to understand, since the data that we get that primarily drives our work plans comes from the Youth Risk Behavior Survey data, which gets taken every other year. So they just completed it every other year. They completed it in 2019. They just completed it in 2021. So by the time we get that data, it's outdated, and new things have happened. So we kind of try to supplement a little bit of that with our community survey, which is an adult survey, versus the youth risk behavior, which is youth taking that survey. We wanted to be able to see, what are we hearing real time in our community, and not rely on some of this data that doesn't contain COVID information fully yet, but also hear from other people who may not have taken our survey because they either don't have kiddos or they missed the survey. So just trying to get a better understanding of sort of what's going on to help us decide what prevention activities we are going to put our time and effort into. So excited to be able to share that report soon with folks. I think, a couple of things that have come out of those conversations is not really surprising. People are definitely seeing an increase in youth mental health related crises in the Upper Valley, as well as alcohol use seems to be one of the substances that a lot of folks are seeing on the rise as well. Not super surprising to us, but it's also just really great information for us to have. That way we can focus some of our efforts. We've already got a campaign that Andrea, I'm sure, will talk about in her staff updates, addressing some of that you might have already started to see on our social media platforms. So hopefully we'll have that report soon to share with you guys. Another thing from my end, I've been working pretty closely with Mascoma School District, specifically the Indian River Middle School, and Caroline Christie, who is the social worker there, on some related prevention activities, and trying to address the increase in vaping that they're seeing at the middle school. From that relationship with Caroline, I've been introduced to the SALT team at Mascoma High School, which is the Student Athlete Leadership Team. It's a group of about 6 to 12 individuals who are really interested in how they can help their peers. It's a leadership group. These kiddos are really interested right now in mental health. So I presented some YRBS data to them a couple weeks ago, and they are going to take that information and create a peer PSA that they can share at their school, but also something that we can share across our channels as well. So really excited to be able to have some youth who are wanting to do some really great things in their school community, but will also be things that we can share with the community as a broader community. So that's a couple of things that I've got going on. Lauren, do you want to do your updates and any young adult stuff?
Yep, I can do that. Thanks. So I'll start with the continuum of care updates. So a couple of things I have been working on related to Narcan specifically. If you recall, I think I've brought this up in almost every meeting, but we had a lot of requests last summer from places of business, like public places, libraries, Listen Community Services, places like that where overdoses have happened at those locations. So they wanted to get trained, which is great, and have kits on site. We are taking that one step further and collecting some data from the local, some of the major police departments where we suspect overdoses may have happened in those towns in public places. So we're collecting location data so we can find out if overdoses have happened in any other places that we want to then reach out to and offer Narcan training to, and offer them a kit. So we've heard back from a couple departments, and so we'll be offering those trainings and also mapping those locations on a physical map, or maybe not a physical map. I'm going to whip out a paper map and put stickers on it. And just to kind of see if there's anything interesting that comes from looking at it visually that way. Also got a request from Dartmouth College to provide training and kits to all of their 28 Greek houses, which is awesome. And then I am happy to report that Newport Police just recently completed their training and licensing requirements in order for their officers to carry Narcan. So they will be equipped with Narcan very soon, as soon as I can get them their doses. I think that's it for Narcan. I think that might be it for major COC stuff. I'm just returned from leave about a month ago, so still getting back into the swing of things and picking up where I left off. So I'll give a couple updates for Danielle. She's the Young Adult Strategies Coordinator. She has been working on putting together a Recovery Coach Academy training. We did this last spring as well, so it'll be the same 4 trainings we offered last time. It's a week-long Recovery Coach Academy, ethics for recovery coaches, suicide prevention, and HIV, HCV prevention for recovery coaches. So there are 4 separate trainings. The Recovery Coach Academy is the one that's a week long. Ethics is 2 days, and the other 2 are just 1 day. So the registration for those will be open soon. We'll be sending out flyers, so we'll definitely get it out to this group. It's a virtual training. We're capping registration at 30 people, and last time it did fill up. We had a wait list, so we're sending it out to those people from the wait list first this time. And so it'll be open to the broader network soon, next week probably. And then I know Danielle is still offering to do the Resilience and Thriving training. It's a training geared towards young adults in the workforce, all around resilience and dealing with stress and healthy coping. She's got it down to about a 30-minute presentation, and she can do it in person or virtually. So if you are interested in that training or interested in learning more about it, you can connect with Danielle and we can get you her contact information. I think that's all for the young adult stuff. She wrapped up an assessment, an assets and gaps assessment, and so we're waiting for a summary report back from our evaluators. That should be ready at the end of next month. So when that is available, we'll also send that out as well. It's all around assets and gaps for the 18 to 25-year-old age range around mental health and substance use. I think that's it.
Thanks, Lauren. Andrew, can I just add something?
Yep.
One of the things that came up when Andrea and I were doing our stakeholder interviews, and some folks might already know this, but this was new information to Andrea and I. So we had talked to 3 law enforcement agencies in the Upper Valley, and we found out that Enfield Police Department carries Narcan, which is really great to hear because Lebanon and Hanover do not, and Canaan does not as well. So and Enfield also told us that they will respond with Narcan to a potential overdose in Canaan if, because they're usually one of the first people to arrive to something like that in Canaan. So it was nice to hear that we do have a police department in our region that does carry Narcan and sees the benefits of it. So just wanted to share that with folks that was a nice thing to hear when we were talking to them, since we know that it's harder for us to get law enforcement agencies on the New Hampshire side to go through the Narcan training and carry. So we do have a police department in our region that does carry.
Thanks, Hillary. And Lauren, I just had a quick question. That report that we'll be getting from our evaluators with the information Danielle collected about the young adult gaps and assets, is that the report she'll be presenting to this group in March?
Yeah, I think if she has it by then, that makes sense. She could probably present it at the next meeting. Yep.
Okay, so so as long as we have it by then, she'll present that either at the March meeting or May if we don't have it in time for her to have reviewed it and put something together. So if you are interested in hearing more about that that report and the information that Danielle gathered from it, please be sure to join us, and we'll let you know via email whether it's going to be in March or May that she goes over that information. In terms of myself for staff updates, so Hillary talked a little bit about this. So following our community survey and these follow-up stakeholder interviews, one key thing that we found is that people in our community either are not having conversations with their youth, their teens, or friends of their children, whoever it may be, about the dangers of alcohol and other substances. So SAMHSA has a campaign that is already put together, and we have, we tried to in these interviews, we tried to get a little bit more information as to why they were not having these conversations. Is it that they're not comfortable? Do they not feel they have the resources? Do they not know what to say? What are these reasons? So we have a few ideas, but SAMHSA has a resource, a campaign already put together called Talk, They Hear You. And it's, it's a very well put together campaign. It has a lot of videos and messaging and already put together flyers or documents, things like that. So it was really helpful just to be able to pick and choose what we wanted to use out of that. Hi, Holly. We're just finishing up some staff updates and then we'll get right to you. Excuse me. So we worked with Bob at Great Eastern, and Bob helped us put together, I think we've got 3 PSAs right now that are running through the month of January. And then we have some, I think maybe 13 to 14 targeted social media Facebook ads, and we're targeting those towards adults in our community that are either parents of a certain age group, or there are a few other interests that I selected that hopefully this would get these messages in front of them. So we're using Sober Truth dollars, which is a supplemental grant to our Drug-Free Communities grant. We're using those dollars to be able to fund this. And really the idea is that this would help provide the adults in our community ideas or resources or information or just different ways for them to be able to have these conversations with youth. And hopefully that will help to increase the amount of people when we do our community survey in, let's see, what was it, 2021? So in 2023, when we put this community survey out there, hopefully we'll see a little bit of an increase in that specific question that we ask. So please be on the lookout. I hope that that maybe some of you have been targeted with these ads, or at least maybe just saw them. Hopefully you've heard them on the radio. But Hillary and I are in contact with our evaluators to see about having this be launched as a long-term, year-long campaign starting hopefully in July. Right now we're doing a soft launch. It's only running through the month of January, and that's sort of because our Sober Truth reporting ends at the end of this month. So we really only had this short chunk of time to be able to get something out there and to kind of see just how what the response was from the community. We're getting some positive messages on our Facebook posts, which is really encouraging. I've obviously we never hear if anybody hears the radio ads and what they think about it. I don't know, Bob, if you ever receive feedback. So again, doing that soft launch now, working with our evaluators to see if this is maybe a year-long campaign that we can do starting in July. Because again, my initial idea was to run this around kind of the big time. So when kids go back to school, or when kids are going off to college, or around the holidays when people are more likely to maybe host social events where alcohol is going to be there, or around prom and graduation. But Hillary said, she had the good idea that like maybe this should be a year-long thing, so that it's always in the back of people's minds, that we're not just flooding them 2 or 3 times throughout the year, but it's something that they're going to hear year-long. So again, we're in the process to see how we can beef up this campaign, but we're excited to see what sort of results come from this, and just keep improving it each time. Let's see what else. So Danielle, who again, our young adult strategies coordinator, she has been working with us on a resource that we'd like to share with the schools that we're excited about. So there are a lot of evidence-based programs out there. And so she has developed a document that has all of these programs listed out based on certain target populations. So we feel this is going to be a really good resource for the schools because, like Hillary mentioned, she's been working a lot with Indian River School. I've been working very closely with Hanover High School lately on certain just topics that they are interested in. So we feel like this resource is going to be really great to be able to share with these schools to say, you know, this is the target population, or this is the substance that you are looking to work on addressing in your school, or you know, something like that. So we think it's going to be a good resource for them to automatically pull this document up, be able to see what sort of evidence-based programs are out there that can address that. You know, how long is the program? What are the projected outcomes? Is it free, or am I going to have to pay for it as the school? What's the just initial summary? So she's got a really good thing put together with that. So we hope to have her be able to share that just for 5 minutes with this group for anybody that would be interested, maybe in March, I think. And then I think the last thing that I'll share is you may remember, I don't remember at this point what month it was, maybe November, possibly, but I became certified as a youth mental health first aid instructor. There were some questions about, you know, how I could go about hosting my first class, what the cost is going to look like. We had a lot of questions, and I think we're finally starting to get those filled out. So I'd love to host at least one and open it up potentially to the community, or if any of your organizations are interested in getting staff trained. This is for an 18 plus age range. That's the ideal person. And again, ideally people that are working with youth. But again, I'd like to open it up just to the community. I've been told in the past that there have been wait lists for programs like this. So I'll send out a more formal email once we maybe get a flyer put together and things like that. But please feel free to throw in the chat if that's something that you'd like to just hear a little bit more about. I can tell you all about the you know, time, what's the word? Time commitment for that, and you know, just what that would look like, anything like that. But I really, you know, with the new year, I'd love to be able to hold one of those classes. Yeah, and that's it. So before we pass it over to Holly, does anybody have any questions for us regarding any of these staff updates?
No, sounds like a lot of great work. You guys are so busy. I'm always just impressed by how much you do. Thank you.
Thank you, Stacy. All right, if I don't see anybody else unmuting. So Holly, are you all set if we start a little bit early?
I am ready to go, Andrea.
All right. So everybody, I would like to introduce our guest for this afternoon, Holly Gaspar. So Holly is a colleague of ours, so myself and Hillary and Lauren, and she is a Senior Community Health Partnership Coordinator for Population Health at Dartmouth-Hitchcock. Holly co-leads Project Launch, which is a federally funded grant through SAMHSA, working to improve community and family mental health through clinic and community collaborations and meeting each family where they're at. And she is a project lead of this newly funded medical legal partnership alongside New Hampshire Legal Assistance, which is what she's going to be talking to us about today. So Holly, thank you so much for joining us. We really appreciate it. And I will pass the meeting over to you. Do you need to let me have you share your screen?
I think Hillary already gave me permission. You guys are such a nice duo.
Perfect.
Hi, everyone. I am going to share my slides, and then I will introduce myself and move forward with our content. Let's see here. This little bar at the top always gets in the way when you're trying to share your, oh, there we go. Come on. Hold on a second. Trying to go to presentation view, but it's maybe. Okay, I think we're good now. Hi, everyone. Thanks for joining in today. So I'm going to, yeah, let's start with myself. So I'm Holly, and I know some of you. So as Andrea mentioned, I work on several projects. I have been with population and community health for several years now. And prior to that, I was a child life specialist working at CHAD, doing direct clinical care for about 10 years. And prior to that, I've worked in all kinds of sort of community and childcare and school and local nonprofit settings, really supporting children, families, and communities And, moving into community and population health, I sort of moved from an individual lens of direct care to more of a system and integration lens. And I just love my work. So I'm really excited to be here today to share with you this new pilot that we have undertaken, a medical legal partnership. This started, several folks at DH have actually worked towards this in the last 5+ years that I've heard about. They're now part of an advisory group that we meet, and we're meeting less frequently now that we are actually integrated in one of our first pilot sites, which is really exciting. So you're one of the first groups to sort of hear about that. And so our advisory group really helped to give a little bit of background information, helped us with some of the assessment and process planning as we've moved forward. And I'll tell you a little bit more about where we are, but let me start with sort of a overview of a medical legal partnership. And I will leave time at the end for some questions. So what is an MLP? And I'm going to say MLP because it's just shorter. So it's a promising innovation that delivers care, free legal services to vulnerable patient populations in the healthcare setting. So it's a partnership between legal and health partners. It's also includes education of healthcare professionals regarding the connection between legal issues and health and well-being. It provides use of screening tools, both in the development of a screening tool and then the functionality of a screening tool to really identify those health harming legal needs that patients might be presenting with. Social determinants of health is also sort of a common vocabulary term that we'll use during this. So health harming legal need, there is some legal implication, but SDOH is, as all of you probably here today know, is something that also impacts their health around things like transportation and food and housing, et cetera. So there's also a referral as part of this process, a direct referral to an attorney that's on site at the healthcare facility who can then provide that legal advice and representation. And again, it's a collaboration between legal and healthcare professionals to address patient needs in sort of a holistic approach. And there also is some local and statewide policy influence and change that happens as part of an MLP. An MLP model really recognizes that legal issues can manifest as social needs that affect the overall health and really works to integrate that sort of holistic care within the health system. So the need, as I mentioned, SDOH, social determinants of health, there's a growing awareness that the impact of social conditions on health has spurred a recognition among healthcare and public health professionals that medical interventions alone are insufficient to improve population health and to address health inequities. Social determinants of health describe the circumstances where people live, work, and play, where they worship, where they age, and they include social conditions such as education, income, employment, housing, neighborhoods, access to transportation, and social connections. The need. We really have seen that vulnerable populations, high-risk populations, really face significant obstacles in accessing the judicial system in general. As many folks know, this comes with a price tag. Often, it comes with a different set of resources, financial resources, but then also connection to the legal services. The same population is also more impacted by social disparities than any other sort of high income or resource supported population. And healthcare workers have noted the high prevalence of these social risk factors and associated legal issues in their clinical practices without the knowledge or resource to support individual needs in their clinic. So, providers are seeing these needs and don't sort of really know where to turn. There was a noted prevalence of these social risk factors with associated legal issues. In fact, there was a 2018 survey of US physicians conducted by the Physicians Foundation found that 88% of physicians who responded to the survey stated that some, many, or all of their patients had a social situation that posed a serious impediment on their health, and only 12% or few felt that their patients really had that support. The Legal Services Corporation, the LSC, found that 71% of low-income households have experienced at least one civil legal problem in 2017, and 24% face 6 or more such problems. In particular, civil legal problems relating to healthcare affected, and 41% of low-income households with issues relating to healthcare debt and insurance are some of the most common. Value. MLPs seek out opportunity to prevent costly downstream impacts on health through identification and intervention. So they see the need and they actually, work directly to intervene and improve that need. Legal professionals work alongside medical teams, community teams to address and treat various complex social needs. MLPs seek to improve situations of individuals, communities by addressing and mitigating impacts of social complexities. I mentioned sort of local and sort of statewide policy change as part of the MLP. So, for an example, there might be something that could be impeding someone's health, pick a population, and those teams work together to sort of advocate for that policy change. So our partnership with New Hampshire Legal Assistance is because of a generous philanthropic funds to support this strong partnership. This strong partnership was really an identification of shared goals and values for improved communities. So we have a New Hampshire Legal Assistance attorney who's embedded at Dartmouth-Hitchcock location where patients will be able to access legal services on site. In our 2-year pilot that we have been approved for, we have one site, as I mentioned, that we actually started with integrated services this week, and that is a Dartmouth-Hitchcock site. We will be planning to identify the second site soon, most likely in the Sullivan County area. So we are still looking for another clinical site that services young children and families. Again, our population's focused on right now, our pilot site's focused on women with children under the age of 5 who are receiving addiction treatment. Our sort of inclusion criteria for that does not have to necessarily be women, but it's parent or caregiver receiving treatment and either has custody or has a child under the age of 5. So could be working on reunification, it's a little bit open for that. And legal services include both representation and counsel and advice. Not limited to issues, but we are including issues around Social Security, public benefits, protective orders, evictions, housing discrimination, and driver's license was actually brought up as a barrier that many patients at our first pilot site location have been impacted and affected by. So our goal as the pilot continues is to identify and evaluate the hopeful success of the program and seek out sustainable funding to continue and expand this medical legal partnership model to other additional populations. And sort of in, wrapping up, and then I'll leave time for sort of overall questions, is why do we want attorneys in the clinical setting? Awareness for the strong effects of SDOH on what they have on the lives and individuals and impact on their overall health and the overall health of populations. Moving current practices from just screening and referral to warm handoff and filling a gap for a previously what was sort of referred to as an unattainable resolution. Decreasing the knowledge gap between healthcare and legal rights and support, decrease barriers for families to learn and access legal services through the inclusion of a community-based partnership as an innovative interdisciplinary approach, and connecting many aspects of an individual's life that impacts their overall health, providing them an optimal opportunity at current and future success. In conclusion, we really want to be there to sort of bridge that need for really some of our most vulnerable patient populations. Some examples that we learned about during our assessment phase at our first pilot site was, a mother who is receiving treatment and really trying to, find her way out of sort of an abusive relationship and needed support for a protective order. So not only supporting that individual, but also supporting her young children as well in helping her achieve that. She did not have the resources, didn't know where to turn. The clinical team sort of didn't know the next steps on what rights that parent had and how to protect and support that whole family. Another one is a young family who has several young children who was found to have lead in their house and was having some discrimination issues from their landlords and not sort of knowing what their rights were as tenants. what financial resources and sort of next steps could improve that. So again, sharing that communication and knowledge both at the clinical setting, but also at the individual and the population level setting. And I could talk about this work for hours. So I'm going to pause there and stop sharing my screen so we can see each other again. And sort of open it up for any questions or further conversation around this.
Holly, can I ask a question?
Go for it, Lindsay.
Well, first of all, I think this is brilliant because this is the population that I work with. And I'm wondering if there's ever going to be any discussion around helping staff that are vulnerable and need of legal advice. Like, has that been a thought process around how, I know it's new, but I'm just thinking futuristically.
So staff at our pilot site location who might be experiencing sort of the same legal needs that might fall into inclusion criteria.
Yeah.
It is not, Lindsay, but I'm going to put that down in our parking lot for our suggestion because I think that's a great one. Yeah, I think that's excellent. Thank you for that suggestion.
Sure. This is really cool.
I will say that I don't know if Andrea sent it out ahead of time, but we do have an echo that's going to be starting as part of our sort of larger education outreach for this topic. So you'll learn a little bit about sort of national and state, MLPs and a little bit more data about that, but then really education around sort of, we have some pretty targeted topics that a planning team developed around housing discrimination, I think eviction in particular. There's a couple really centered around young children and families that are really meant to sort of span the broader community of community agencies and partners, not just clinical settings. So if you haven't seen that yet, it is free. It will be starting up in about a month or so. So you want to register for that. And please share it out with your networks.
I had a question, Holly. I'm in a referral group, and I've met a woman who is with a group called, I think it's Lido Advisors and Advocates. I don't know if you're familiar with them. I had never heard of them before, but apparently they do very similar things, in particular with, families that are breaking up through divorce and different things like that, but they're also involved with a lot of family court issues. And like I said, I've only met this person once, but she told an absolutely horrifying story in a referral group, and it rings very similar about trying to access legal help in some of these, really difficult areas. And you can actually, I think you can Google it and get the local person. I thought I had her business card here, but it's Leto, Leto, and I think it's Advocates and Advisors. And I think they have locations across the country. And I believe this woman is a lawyer, but she's also, I don't want to use the word victim, but she's been through a series of circumstances that were very difficult, and the legal challenges that came about with that, with custody and all that kind of stuff. So that might be something locally that might be a good connection for the stuff that you're doing.
Thank you so much. I have not heard of that group, so I made a note and I will take a look at that. So thank you for the resource. And I should also sort of share that, we have our staffed MLP lawyer, and so we do have the inclusion criteria I mentioned. The legal issue needs to have happened in New Hampshire. There needs to be somehow a child under the age of 5. We really left that pretty open because we know families sort of look different. And they also need to be receiving some kind of medical care at our pilot site locations. And so if they fall into that inclusion criteria and they have a legal issue that falls under civil legal issues, not criminal, then they will be directly connected with legal representation from our lawyer. If they fall out of that exclusion criteria, or if they're not in the inclusion criteria, they're exterior, or there is something else, then they will be directed to other resources such as like 603 legal aid and but really connected through New Hampshire legal assistance to then sort of take it a bit, further and really do that warm handoff, which is I think really it really feels supportive to the clinical teams that we've been working with so far in developing that. So it's not just sort of like a, oops, sorry, you don't fit this mold for this project, but we're going to actually connect you anyway, which is great.
Hi, Holly, it's Peter. This fantastic program. There is something parallel that is going on now with the geriatric population that's pretty well developed. You didn't mention where the pilot site was. Are you working with mothers in recovery?
We are, Peter. It's Moms in Recovery right now, and we, have no idea how quick this is going to catch on. Right now, there's approximately 70 patients that would fall into our inclusion criteria, and what we're hoping is that that's manageable. We don't know what percentage have civil legal issues at this point. Chelsea's been there for 2 days, and so once we're able to learn a little bit and then sort of run a PDSA cycle or two, we will then hopefully expand to all of ATP in that center that fall into our inclusion criteria. So really opening it up beyond just moms.
Yeah, I mean, I think you pretty much answered my question, but to get a little bit more clarification as you move along with this, I see women who are at headrest or in groups recover together who don't have their kids. They're trying to get their kids back, and they may have PCP at Heater Road, so they're connected with the Hitchcock system, and their kids may actually be getting their pediatric care through Hitchcock or through one of the pediatricians of family docs over there. Are those people who ultimately would be could be referred into the program?
Not as of yet, Peter, and I really have a hard time saying no because, OBGYN has been asking sort of the same question. And I think what we're really trying to do is phase out this project because we only have a 1.0 FTE of our lawyer right now, and that's really just due to funding restrictions. So while we'd want to say yes to everybody, there's only a 1.0 right now. So we want to make sure that we don't take too much in our first couple of weeks. We are going to be looking for a site in Sullivan County. And I have not yet had anyone sort of opening the door yet. Although I'm hoping our early success will help with that. So if that does not happen, there could be an opportunity, Peter, to expand more so in the Upper Valley, knowing that patients come from, a distance. So we'll just have to see. But it's a great suggestion, and I'll keep that in mind. There's so many intersections of our large healthcare center, and so it gets complicated with the inclusion criteria. I will speak to your, don't have custody of their kids, and that's why we really left that inclusion criteria really open, because we know that there might be a barrier around these health harming legal needs that is impacting that. And so we want to make sure that it, isn't this traditional, like you have to have your kid in your home. So we're really being really open with that and hope that that helps to support strong, healthy families.
There is one of the caseworkers over at the Haven is one of the community coordinators is a lawyer. And might make a connection with her. And she does some of this work a little bit over on the Vermont side. It's Rebecca, I forget her last name, but and I'm sure she would be thrilled to hear about what you're doing. I'm really excited about this program. Congratulations.
Thank you. And thank you, everyone, for these wonderful suggestions and connections.
Holly, I just had one question. I think I may have missed it, so I apologize. I know that you had mentioned that this really came from a generous philanthropic endeavor, but can you just remind me how it came about that you're working with people in addiction treatment? Was that part of this philanthropic, that was a criteria they wanted, or is that something that this, 1.0 FTE, this lawyer specializes in working with that population? Can you, and again, I apologize, you may have already covered this, but can you talk a little bit more about why this is the, that population that you're working with?
Yeah, Andrea. So our generous philanthropic funders are New Hampshire charitable foundations and the Couch Family Foundation, and then also Dartmouth-Hitchcock. New Hampshire Charitable Foundation has a prevention, wing and lens to their work, and so that is one of them. Couch also, as folks know, too, have an early childhood and family focus. But I will say our funders also give us a lot of openness to sort of go sort of where the needs are. I would say that the other piece that we sort of discovered is definitely vulnerable populations and disparities with populations and folks that, may be impacted more on the sort of legal or civil legal barriers or access to. So I think it just, and are working really, really hard. Yeah. And this was also a team who were like, come, please, and help us and help our patients. And we see this as a real benefit as well. So yeah, I would say that there's sort of a combination of all of those.
Thanks, Holly. So we've got Holly for a couple more minutes. So what other questions do you all have for Holly, or is there anything else that she can clarify about this pilot program?
Could I just ask what kind of a place you're looking for in Sullivan County? What are you looking for, an organization, a space?
Yeah, we'd be looking for some kind of a medical partnership, and also one that serves young children as one of our criteria. We do have relationships with Valley Regional and Newport Health Center, and I've had conversations with them. I will be revisiting those conversations. I think, Margaret, really right now it's, capacity on our clinical teams is just, COVID has presented just some real limitations with capacity and staff turnover and things like that. So I also have found that this project in particular has not taken up a lot of clinical team time. I've run several different clinical team projects, and this one seems to kind of really fall on both the lawyer and then New Hampshire legal assistants in general, and then myself as a project director of this work. So that's what I'm also hoping to be able to share with those clinical sites, that we're really, really hoping not to overburden them with like more meetings and more reporting and more data and things like that. So I think once we're able to learn a little bit more, that hopefully we can relieve that of some of their questions. New Hampshire legal assistance has a wonderful data collection system that we're actually able to use alongside of them, which will be really exciting to report out on some of sort of the outcomes. And I'm happy, Andrea, to share that back with this team. Sort of in follow-up, we'll be creating quarterly project team report out. So for some of our stakeholders and partners, if folks are interested.
Thanks, Holly. I just had one more question. So you mentioned that there's one full-time lawyer right now. So when it does expand into Sullivan County, will Chelsea be doing both or both sites, or is this Moms in Recovery program only for a certain amount of time and then she'll move down to the Sullivan County area, or what will that look like?
Yeah, so both sites at the same time, Andrea, and that's kind of why we have our inclusion criteria. And we just need to sort of see, we've been looking and in contact with the National Center for Medical Legal Partnerships, and it seems to be for the patient load of both, of what we're looking at least knowing Newport or Valley Regional or some other site, just knowing the amount of pediatric patients and then alongside Moms in Recovery, that it seems like something they can handle. Typically, they're able to handle about 100 referrals, through the 2-year span. I don't have the exact number on how many patients they're able to help right now, but I could certainly send an infographic. There's usually about one policy change that happens in that time period as well. There's like set amount of education hours that are put out as well. So we're pretty on par for that sort of standard that they've learned from the other MLP models. But that's kind of what we're keeping in mind, is especially to address sort of Peter's question about like, can we just, what about all these other locations and sites within the medical center? We just want to make sure that we're not taking on too much with the FTE time that we have right now.
Right. Well, thank you so much, Holly. It's 3:01, and we asked Holly to be here for about 20 minutes or so, and that's what she's given us. So please, if you have any additional questions, after this meeting, something else pops up in a week from now that you had a question on, like we mentioned, Holly is a close colleague of myself, Hillary, and Lauren. So we have access to her as much as we want, so we can get any of those questions answered. And Holly has also put her contact information into the chat. So feel free to send her an email if you have any other questions. So thank you so much, Holly.
Thanks,
Feel
everyone.
free to hop off.
Thank
I know
you.
you're a busy woman.
Thank you, Allie.
Yeah, so thank
Thanks,
you.
everyone. Thank you.
All right, so next up on the agenda is we wanted to do some vision planning with this group as just a small activity. So as some of you may remember, if you were on the September meeting, I think it was, Hillary and I went over our work plan. So I talked a little bit specifically about my substance misuse work plan that I have to submit to the state of New Hampshire. And then Hillary went over some of her drug-free communities work plan. A lot of our work completely overlaps, but there are some things that are a bit more specific just in terms of requirements for the different grants that we work on. So we talked a little bit about that in September, but now we wanted to take some time to work on a capacity building activity with the coalition. And like I mentioned, that's just going to look like a little bit of vision planning for the 2022 calendar year. So we're going to talk a little bit about the past, the present, and the future. So this is just going to be a brainstorming opportunity. So please feel comfortable. There are no right or wrong answers, but this is just an opportunity to give you all a voice. I know Hillary and I have done some other key stakeholder interviews with a handful of you, so some of this might be a little bit repetitive, but we wanted to give other members, other partners, the opportunity to help us kind of plan out what the calendar year 2022 is going to look like. So as I mentioned, please feel free to unmute and just speak up with some of these prompt questions that I have. If you're not comfortable with that, put it in the chat, and we'll be sure to collect any ideas that people have. So we'll just work on this for about 15 minutes or so, and then we'll move into any partner updates or asks that we have, and then that'll be the end of the meeting. So the first thing that we want to focus on is, we want to look a little bit into the past. So if you maybe this is your first All-Together Partners meeting, that's completely fine. But I would ask that if you've ever heard of All-Together before, if you are aware of any of the work that we do, feel free to share just what you've heard of before, because that will also help us learn how we're doing in terms of getting our name out there and letting people know about the work that we're doing. So if you can think about, again, thinking of the past, what do you think we have done well as a coalition? And that's pretty open-ended, so I'm gonna leave that open-ended for you to be able to answer that in any way that you would like. So what have we done well as a coalition in the past?
Yes, for me, I would say you guys do a great job of gathering all the very many pieces of things that are going on and bringing them together and making sure that everyone is seeing all those things, because it's so easy to miss things in the community.
Thank you, Stacy.
I think certainly early on when Altogether started, it was a good forum for people to be able to inform other people who had similar goals or working in the same area, to have other people have the opportunity to share with other people what they're actually were doing. So we became aware of resources that we would not have been aware of otherwise. I met people I didn't know, and that was helpful. I'm not sure if that still is in effect over the past 6 months or so, but certainly when it was in person, that was really one of the real benefits of it for me.
Thank you, Peter, and I'm glad you brought up the in-person. At this time, we don't unfortunately have any updates. I know we've all been really itching at getting back in person, but with just the way that COVID has, keeps changing, we've still have had to delay meeting in person. So I think maybe that's another thing that I'm hopeful for, that possibly we can meet in person at some meeting this year of 2022. So I'll cross my fingers. Okay, what else? What else have we done well as a coalition?
So I haven't been to any meetings recently, but I know in the past, attending meetings, a lot of sectors were represented. There's, you always had and still have, good attendance at those meetings, interesting information to share, a lot of collaboration, and like brainstorming like we're doing now. Also, I know, gosh, this was years ago, but the event at Montshire around cannabis was, being in prevention, it's hard to get anyone to show up for events that I've experienced, and that was very well attended. So that was, great to see.
Thank you, Courtney.
I know you've already heard from, this is Matt. I know you've heard from me before. But I appreciate the fact that others are saying sharing information, making information available. I think that's one of the things that Altogether is really top notch at, and that is just getting the information, finding out what's useful, making it useful, and making sure that it gets to where it needs to go.
Thank you, Matt. So I'm going to move to the next question that seems like it may be a little repetitive, but so this question is, what has been successful? So we just talked about what we've done well just as a coalition in general. So is there something that you feel like that was not captured? Maybe is there I know Courtney talked about the cannabis event at the Montshire, but is there maybe a specific event or campaign or just thing that you feel like has been very successful over the past number of years? And if you feel like it was already covered, that's fine.
I'll jump in here. I was reading the paper this morning, and they were talking specifically about Narcan kits and who has them available and all that kind of thing. And I think a lot of the awareness that is being generated on kind of a grassroots level has been directly linked to not necessarily the fact that people know that what Altogether is, or the real specifics of this organization, but more so that it's a real connection point. And several years ago in board meetings, when somebody came in and said, "Oh, we got these Narcan kits," I had no idea what you folks were talking about, because I'm a radio guy and I'm not on the clinical side at all. So I just hear so much more of the language that we would be using in our meetings and doing plannings and doing events and doing outreach and posting things that is now more part of the dialogue that you see across all the different spectrums out there. And whether it's the opioid thing, that the opioid films that we've helped talk about, and the marijuana thing was really terrific. The drug take back day stuff has been really successful. I don't think you can really kind of put it into like a ball, but just kind of organically across the Upper Valley, I hear more and more talk about the things that we have talked about even from the beginning in these meetings across all different kinds of things, resource officers in the schools and things that you just don't necessarily hear too much about, but now I hear about all those different things across the board. So I think it's not direct. It's not like me ordering a donut and driving up and picking it up. It's not a 50 cents and something back for it. It's much broader than that. But I think the enhancements for knowledge have been greatly expanded, and certainly just talking to people out on the street, if I mentioned, well, Altogether does this kind of thing, they're kind of aware, whereas 6 or 7 years ago, they would look at me like I had two heads. So I think to me, that's real progress. And, ultimately the goal of being a catalyst for all this information is being met.
Thank you, Bob.
think for me too is just you guys are always open to whatever idea I may have, or whatever question I may have, or whatever anything. Like it's never Stacy, that's out of scope or whatever. You always listen, think about who you know or how we could make it happen, and you know support. And I think that here, so that's being nimble and open-minded as an organization. I think is gets to what Bob is talking about, which is it's here, it's there, and I think that that's really worth noting.
Thank you, Stacy.
And I would add, so, I got connected to All Together when APD was interested in advocating for a Tobacco 21 ordinance in Lebanon, and found that All Together and then the Lebanon push were very helpful to get build connections and build support really quickly, and ultimately be successful in passing the ordinance.
Thank you, Liz. So my next question is, what do you feel like has not been successful, or where have we struggled as a coalition? And please know you will not hurt our feelings with any of this. This is the only way we're going to get better as a coalition moving forward.
I think from the beginning, since I have been around that long, it's been a challenge to get partners from all different areas across the board, to fill those sectors. So that has been a challenge that comes in waves. Sometimes we're so full, and then other times we're not.
Thanks, Lindsay.
I don't think I can think of too many negatives. What you folks do on the inside, when you send out information, just like Stacy was saying, I'm always just overwhelmed in a very good way about just reading all of these programs and all of these events that are happening. And if we're not fulfilling our goal of being, like I said earlier, a catalyst for that, I don't know what. I agree with Lindsay that we don't necessarily have all of our sector categories filled, but you know what? It doesn't seem to get in our way. Or maybe we're lighter and we're more flexible and versatile in being able to move through those things. But in terms of just disseminating information across all these different people in all these different specific health areas, is there anything else in the Upper Valley that does that? I don't know as if I could think of anything. There are certainly programs out there, but I'm sure within the clinical world that there are people that say, oh yeah, just go to All Together's website or go talk to this person. I think that happens all the time. So we're almost perfect.
I think the only thing I've struggled with, but I think it's me, and you're just too kind to not say it's you, is the understanding all the different roles of the people involved and how it lines up at Dartmouth-Hitchcock with community health. And I just can't get it straight in my brain. So unfortunately, I always go to Andrea, but she's nice enough to not say, you idiot, that's not me. But I don't know. So maybe that's an opportunity, but I really think it's me. So I don't know.
No, I don't. Thank you, Stacy. I don't think it is you. I think it is very confusing what all of us do. And, Lauren and I are part of the Upper Valley Regional Public Health Network, which is technically the Public Health Council of the Upper Valley, whereas Hillary's not part of that, but she's doing the prevention work and speaks at the public health. So it is very confusing. So Stacy, we will follow up with you. I have a couple of ideas of maybe how we can address that. So I'll touch base maybe offline about that. So just for the sake of time, I'd like to move to the present, but please feel free We have a Google form, and I will double check, but I think there's a spot on the Google form that maybe it's anonymous. If you do see some challenges or things that maybe we haven't been successful with, if you are not comfortable sharing that in this space, please feel free to utilize that Google form to share that information with us, because again, Lauren, Hillary, and I very much accept constructive criticism. We want this coalition to be successful. We want to be meeting the needs of our communities. And we're only going to do that if we get the feedback from our community partners on what we're missing and what we can do better. So for the next handful of minutes, and I acknowledge I'm going to go a little over 3:20, but we had a few folks pop off, and half of us have already talked about what we're doing. So I think if we cut into partner updates just for a minute, I think that will be okay. So my question about the present is, I'm interested to hear from you, or we're interested. What do you want to see more of from us as a coalition?
One thing that we're kind of focusing on with the YRBS data is specific to LGBTQ plus students and color with the data substance use and mental health. And so I don't know if you guys are doing anything particular around that, but that's something we've, basically we're just kind of in those beginning stages of sharing the data with community groups, with supervisory unions, but it's kind of the now what part of that. And that's where it gets, like how to be supportive in a way to change those data points. But, you're working with schools, which can sometimes be tricky, and, trying to get community members involved. So if you guys have, it helps us too, but if you're doing anything around that, that's something that's definitely an interest of mine personally, but also, with those vulnerable populations with those data points in particular.
Thank you, Courtney. I'll share one thing that I would like to see more of is I'd love to see more town hall or community-wide informational sharing events. I think COVID really has put a damper on that for the past 2 years. And we've tried to have some virtual spaces to do that, and people didn't seem interested. But I, like Courtney mentioned, this event at the Monshire, in our conversations with other people, they've really talked about some of these in-person events that we've held that are really great networking and really great ways to get information out to the community. So I would love to be able to see more of that, and understanding we may have to adapt and make it change, but I would really like to, for 2022, have some sort of a successful kind of town hall or community event. I do know there's something, and I know Kim had to hop off, but there's something being voted on, I think, in the legislature about commercialization of the legalization of commercialization of cannabis on the New Hampshire side. So following just how that progresses, I could see certainly an opportunity to work with our municipalities on something like that. Anything else that you want to see more of?
I really appreciate the survey results, because those are a window that people don't get to see, and the more that we can share the other see other people's surveys, I think is a big help.
I don't know if Altogether sees itself, or the board sees itself as doing these things, but I think that it's very difficult for a lot of people working in this area to get adequate funding for a lot of the projects that they're interested in. And you guys are really slick at getting funding. I mean, and I wonder, it's sometimes we work at cross purposes because we're competing for the same money. But it might be nice for Altogether to somehow have some kind of a forum around funding, so that people are aware of the various sources, and how to go about getting money for things, because you have a lot of talented people and people with good ideas, but they don't know how to go about getting money to carry out these projects. And sort of related to that, we have such a a paucity of, that's not the right word. We compete for personnel in all kinds of organizations in the area. You know, there aren't enough people around with the skills to go around, and so we're competing with each other to hire people, and it's like musical chairs sometimes. I think you even see that within the Dartmouth system. So I wonder whether or not there might be some benefit in having some kind of a forum talking about the kinds of people that we need to fill a lot of the slots. And we talked a lot when the IDN was functioning about growing our own and training people to do a lot of these things. And so maybe altogether could be a source of discussion about how we do that, how we recruit people to do things, how we train people to do things that are necessary to carry out a lot of these projects. As I said, I may be out of line on both of those things, but they're things I see as needs.
No, thank you, Peter. That's a great segue to my next question is, what sort of topics do you want to see us covering? So I think that's a really great idea, this idea of funding and what are the various funding sources and how can All Together be support, or Dartmouth-Hitchcock, our community health team, how can we support some of these efforts across the community? So what other guest speakers or topics would you be interested in hearing more about? We have our running list of things, but I'm curious, what topics would you be interested in hearing more about it at these meetings?
I can tell you, just to sort of detail onto what Peter was saying is, I think it's very true that like everything else, there's a scarcity of resources. We do compete for not only same funds, but same talent pool, so to speak. And the whole idea of training people, having trainings, as Peter was speaking, I was thinking, maybe Altogether can develop a farm league in terms of, generating talented people, skilled people. And I'd love to see more opportunity for training in order to sort of share the wealth when it comes to getting people out into various communities.
Thank you, Matt. Any other ideas of different topics or potential speakers that you'd be interested in hearing from? Okay, well, I see that Hillary put the meeting evaluation in the chat, so thank you. So there is an opportunity towards, I think, one of the last questions for you to put in if you have any information in terms of who you'd like to hear from, what topics you'd like. So take a moment and think about that. So we will now move to our last 5 minutes to give you all an opportunity just to share any updates that you have from your organization or any asks that you have from the rest of us. How can we help you?
I don't know if people remember, Andrea had talked about the Operation Parent Handbook booklets that she's got. And if you haven't seen them, they're worth a look for sure. I got a sample of both of them, the elementary age and the middle school, high school age, and they're fantastic. They're really well written and really well presented on really hard topics for parents to talk to children. So I'm in the process of reviewing them. I've got a bunch of people looking at them to try to get a whole bunch of them for associate caregivers at Hypertherm. But if you haven't taken a look at it, I recommend. I also talked with the person online, thanks to Andrea, and learned more information too about how they have some free webinars that they offer parents and things like that. So definitely worth a deeper dive if you're not familiar.
I was just gonna say I attended their it's like Netflix and social media and whatever influence one yesterday, and it was pretty decent. I was impressed. It takes a lot to impress me for trainings these days. But I thought it was well done. So yeah, the Operation Parent in general, I think is a really good resource.
Thank you. Any other partner updates or asks from the group?
Well, I just want to say that that's good to hear, Stacy and Lindsay, because I think our social worker in primary care had been interested in them, and I just hadn't had the time to really check them out to see if they would be worthwhile. So maybe I will kind of push it back up to the top of my list.
Yeah, and if you do go down the road of wanting to buy like a bulk amount of them, they'll cut a deal with you based on how many you will buy. And so I can share the contact info of the person I spoke with, and she was super helpful. So
Yeah, that would be great.
And Liz, I can't remember if I gave your social worker some books or not, but if I did not, we have plenty on hand, so I'd be happy to drop some off to you if you need them. So just let me know.
I can't remember either, but if you wanted to drop some off with me, then I can actually, when I have something physical, it's easier for me to take a look.
Okay, that sounds good. I'll email with you to coordinate that.
Perfect, thanks.
Mm-hmm. Anything
And
else?
I had one other, I had touched base with our social worker in primary care who knew of a patient who had a patient in MAT, but with a lot of dental needs, and was able to arrange some funding to help this patient get dental care, and then did some investigation and saw that, I can't remember what state, on the West Coast somewhere, or in the western half of the country, that someone had done a program where they provided dental care to patients going through recovery, and found that it greatly improved the odds of recovery and helped the patient build relationships and find a job and find housing. So was able to get some additional funding for more patients in MAT with dental needs, and we've kind of started to just roll it out. Yeah, so it was exciting to put all those pieces together, and hopefully we can help some patients.
That's great, Liz. Thanks for sharing.
Mm-hmm.
One thing that, if anybody knows effective ways to do outreach to pharmacies, especially corporate pharmacies, Mount Scottney and the HIV HCV Resource Center created a Narcan booklet that explains what Narcan is, what can be used, how to use it, and then connections to treatment and recovery services. And we've been successful with the independent pharmacies, including the booklet, along with a CPR mask and instructions, and with any Narcan that's prescribed. And it's the chains that there's always, that ladder you have to go up through and get approval. And I think so. If anybody knows any shortcuts to that or tricks, I'd definitely be interested in learning that.
Thanks, Courtney. I'd love to stop up and take a peek at that sometime if I could, just to see what you have.
Absolutely. I can, I'll email you the files too, if you wanted to look through them and see if they're in person.
Thank you. All right, so just for the sake of time, because we want to respect everybody's time, it is 3:30. So as I mentioned, Hillary put the meeting evaluation link in the chat. So if you could please just be sure to click on that and open it up so that at least you have it once we close out of this meeting. And if you need a day or two to think about how you want to respond, that's fine. We just appreciate any sort of feedback that we can get from everybody. So if there isn't anything else, then I think we can end this meeting. So thank you so much for everybody for joining in. Thank you for participating in that vision planning. Stacy, it looks like were you waving, or do you have something to say?
Oops, no, I was just waving.
Oh, just waving goodbye.
Thank you.
All right, everyone. Thank you so much. Have a great night.
Thank you.
I think Matt took a nap with his cat. He's having a cat nap. Bye, everybody.
Bye.
Bye. Thanks, everyone.